The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. Thank you so much for joining us this morning. My name is Jennifer Vivian, Manager of Entrepreneurial Services at the Brampton Entrepreneur Center. And today I'm joined by my colleagues Daryl Van Moorsel, Sector Manager of Advanced Manufacturing, and Martin Bull, Sector Manager of Health and Life Sciences at the City of Brampton's Economic Development Office. Also on the call this morning is Mike Mullick and Jean-Pierre Maurice from the City of Brampton's Enforcement and Bylaw Services Division. Thank you so much for joining us this morning for part one of a webinar, the series the City is hosting in partnership with the Region of Peel. Today we are delighted to have Dr. Lawrence Lowe, Medical Officer of Health with the Region of Peel, on today's webinar to speak to you about how to prevent COVID-19 in the workplace and answer your questions about safely reopening your businesses. Before we begin, I would like to go over a few housekeeping items to ensure this morning's session runs smoothly. First off, everyone has been muted to avoid any background noises. So if you have a question, please use the question box on your attendee control panel to submit your question. These will be addressed at the end of the webinar during our Q&A session. If we are unable to get to your question today, we will follow up with you after the session to ensure you get the answers you require. Also in the attendee control panel, you'll see a handout section. Here you can access a copy of today's presentation along with some other resources. We have Valerie from the Region of Peel also on today's webinar and will be active on today's chat box to provide links to various resources you will need as you begin to prepare and reopen your business. Lastly, today's session is being recorded and we will share this with you after the session this morning. We have a lot of info to cover today, so I will let Dr. Lowe take it away.
Wonderful. Thanks so much for the introduction and good morning, everyone. And really appreciate you taking some time this morning to talk about key steps in reopening your business as we move forward with COVID-19. As you all know, it has been approximately 3 weeks now since Peel and Brampton entered stage 2. And with the recent provincial announcement, we are looking eminently at stage 3 if continuing trends are followed here in Brampton as well as in Peel. And so whether you have already reopened your business or if you are about to or thinking of reopening your business if we move to stage 3, I'm hoping that you'll find the information useful today. In today's presentation, we're going to talk a little bit about the current status of COVID-19 in the Region of Peel and in Brampton. We'll talk a little bit about Ontario's framework for reopening, and then we'll talk about measures to control the spread of COVID-19 in workplaces, most critical upon which is a provincial workplace safety plan that you can build those precautions upon. We'll also talk about the various roles and responsibilities of yourselves as employers, the Ministry of Labour, and also Peel Public Health. And then finally, we'll provide you with some helpful resources. As of July 10th, we have now seen over 6,000 cases of COVID-19 in the Region of Peel. Over the course of the outbreak, you can see that many of those have been in the urbanized south of the region, in the cities of Mississauga and in Brampton. And certainly of note, I will draw your attention to the far right-hand side of the graph, which shows that since early May, when we began to reopen, the vast majority of cases actually have started to come from the City of Brampton. Now, a lot of this has to do with Brampton's employment and economic profile. I understand, of course, that there are many businesses in Brampton that, by virtue of the nature of business that they operate, there are challenges in physical distancing, and there is not an opportunity for many of the employees to work from home. So if your business is in that situation, it becomes doubly important to sort of keep that in mind, that the experience of businesses that have opened before you has been that on occasion, if an individual, particularly someone who has very mild symptoms, has COVID-19, this is where we've been seeing workplace outbreaks. And it becomes that much more important to ensure that you have a workplace reopening plan and that you're able to open safely. Overall, though, as you can see in terms of the overall wave, we are now very much in the tail end of the wave here in the Region of Peel. Our declines continue to occur pretty much since the high of 120 or roughly hundreds to hundreds and 20s of cases a day in mid-April. down to approximately 20 to 30 cases a day here in Brampton. The median age of the cases is usually around 45 years of age, and the vast majority of them have been reported amongst people under the age of 65. And in fact, 46% of the cases are among people within the ages of 35 to 64, which really speaks to the importance of ensuring that our working age population is kept safe. And in terms of institutional exposures, this refers to things like long-term care homes and other congregate settings. 25% of the cases were due to that. And there have been overall 48 outbreaks of COVID-19 in long-term care homes and other institutions, with 1,000 of the cases, so nearly 12% of the cases linked to the outbreaks. This means, though, that almost 75% of the cases are still occurring in the community or are related to individuals in close contact. And so we need to be vigilant, particularly as we continue to move forward. I think nobody on the line, none of us want to see a return to the closure conditions that occurred in March. And I think we've sacrificed a lot to get to the picture where we are, and the opportunity to continue opening steadily and in a considered fashion, as opposed to what has been seen in other jurisdictions, most notably in the United States. So we have an opportunity now. We know who's getting COVID. We know the rough median ages, and as proprietors, as business owners, as operators of various establishments, it's important for you to be aware around what you can do to continue to keep COVID down while we unlock our economy and unlock our community again. The province's framework for reopening beyond just case count also specifies a number of other indicators that we track. This includes healthcare system capacity, public health system capacity, and testing capacity. In general, the aim is to reopen with an understanding and a look at the indicators for all these various pictures. And in the region of Peel, we have seen that we have used or put together various indicators that are not necessarily acting as thresholds for go or no go, but are more pointing to areas that may need attention as our community continues to reopen. So, for example, in terms of monitoring cases, we do take a 7-day moving average. We look at the severity of cases in hospitals, and we look at active outbreaks in Peel institutions, including long-term care homes. And all of those trends are generally going in the right direction, even if they don't necessarily meet the specific provincial targets. And you can see that in our healthcare system and our public health capacity, we meet all of the provincial targets that have been identified for preparedness, which really speaks to the idea that even though we don't necessarily get to or haven't necessarily got to fully where we want to be in terms of average daily cases, we do have the capacity to respond, which is the most important other consideration as we move forward. That said, responding is only what happens after transmission has occurred, and it's very important for us to take steps to prevent transmission of COVID-19 in the first instance. Like the old analogy goes, the best ambulance system in the world will do nothing to prevent car crashes. So we need to make sure that we are putting in controls and precautions in place that will allow us to minimize the spread of COVID-19 at the source. And we can do so by using a principle called the hierarchy of controls. Elimination, substitution, engineering controls, administrative controls, and personal protective equipment. These are listed as a triangle from most effective to less effective, simply to show that on their individual basis, many of these will only be partly effective in helping to reduce the risk of transmission of COVID-19. And it really is a matter of taking all of these controls together in the hierarchy, putting them effectively together, and making sure that they're all strictly adhered to as we go forward. So I'm going to talk a little bit about what these are, but if you just remember elimination, substitution is less relevant to COVID-19, mind you. But essentially, if you focus on elimination, engineering controls, administrative controls, and personal protective equipment, that's things like making sure that sick people don't come in, which is elimination. Engineering controls are things like plexiglass. Administrative control are things like staggering hours of work or limiting the number of people on site through policies, sick leave policies. And then personal protective equipment is speaking to things like masks, which are really the last line of defense when you get down to trying to control spread. The aim of all those controls that I've talked about are really to promote the behaviors that are listed here, what we call the core 4 behaviors. There is no secret as to how we can continue to keep COVID-19 at bay while we go about our lives in our community. The disease spreads from person to person, and so to the extent that we can keep people apart and minimize risky interactions in close contact, that will help us to actually get ahead and continue to stay ahead of the virus. So in all the controls that you're looking at here in terms of the elimination, substitution, etc., what you're looking for is you're trying to ultimately promote these behaviors. So you want people to be able to stay 2 meters apart for everyone outside of their safe social circle. You want to have ample opportunity for individuals to keep their hands clean through lathering up and washing their hands regularly and frequently. You want to have people mask up where physical distancing is difficult, and including where masks are mandatory, which is typically where in places where physical distancing is difficult. And masks are used mostly to prevent the expulsion of droplets at the source. Really, it's about keeping other people safe when you are in close contact and where staying apart is difficult. And finally, if you are feeling sick, the most important one, if you go to the elimination point, is to ensure that people who are sick get tested and then stay home to prevent potential spread. So we'll talk about the workplace reopening pieces, and these will all be, these core 4 behaviors are essentially the ultimate goal in terms of what you're trying to put in place with your workplace safety plan and your precautions. The idea is that if everyone is able to practice these core 4 behaviors regularly and consistency, we will continue to beat COVID-19 in our community. So, in developing a workplace safety plan, you are asked to think about 6 questions. 4 of them are speaking directly to the risk of COVID-19, and the other 2 speak to just overall business management around implementing a safety plan. So the first one is, how will you ensure that all of your workers know how to keep themselves safe from COVID-19? This will be things like training, etc., and I'll get into details on this on the next slides. The second one is, how will you screen for COVID-19? How will you ensure that individuals are not bringing the virus into your premises or your property? Because again, elimination is the first line of defense. The third one is, how will you control the risk of transmission in your workplace? So in the event that people do come in, or if there is an exposure that occurs, how will you make sure that there are precautions in place that will limit the extent that exposure might impact your staff's health and your business? And finally, what will you do if there is a potential case or suspected exposure to COVID-19 in the workplace? And this is where I will go a bit into the roles and responsibilities of the Ministry of Labour and Peel Public Health and employers, and how we'll work together. In implementing any good safety plan, the final 2 questions really speak to what you need to do in order to make sure your plan is working. And so the 5th one will be, in the way you change your business, there may be other risks that emerge if you change your business, if you change and put in precautions. So identifying any other risks besides COVID-19 that are associated with the changes. Maybe you need staff to take more frequent breaks, or maybe there needs to be an ergonomic assessment depending if things have changed. You will need to think about other workplace risks that will be caused by the change and the precautions that you are taking, and make sure that you are mitigating those as well, because we know health is holistic. And finally, you also want to make sure that there are ways to evaluate and monitor that your plan is working. Regularly double checking to make sure that you're keeping the risk of COVID low, that you're managing the other risks that might be associated with the changes, and that you're also altering or changing your context depending on the situation in the community. So for example, you may start, if you're a retail outlet, for example, you may start to welcome people in to your facilities again, but then you may choose, if there becomes an increase or a spike or a second wave, to curtail the extent of people within your facility and moving back to, say, curbside pickup or delivery. So making sure that your plan is working involves double checking and ensuring that the steps that you're taking on site are working for your staff, and also tweaking the precautions that you are taking depending on the state of the virus in our community, as well as any other risks that you've identified. So how will you ensure that all workers know how to keep themselves safe from exposure to COVID-19? Workers must be, to the extent possible, supported in practicing the core 4 behaviors. And so certainly training, education, things like how you actually hand wash, how you put on and use a mask properly, how you measure physical distance, making sure that you put administrative things in place, such as avoiding crowding, making sure that you are putting markers in place so that people can stand 2 meters apart and they have visual aids, reminders and visual reminders everywhere, posters, videos, resources. These kind of materials for training and constant development of your staff are available at our website at peelregion.ca/coronavirus. And really, it's important, and it's also incumbent upon employers under the Occupational Health and Safety Act to ensure that workers are given the tools and the knowledge that they need to do their job safely. And specifically in the time of COVID-19, the resources that we have available on that website will help you meet that responsibility in ensuring that your workers are able to protect themselves and do the core 4 behaviors to stay safe. The next part of your workplace safety plan will speak to screening. And this is really about to prevent employees as well as customers with any symptoms from entering. You can undertake either active or passive screening. And so active and passive screening, the essential difference is passive screening is putting a poster like the poster that you see on the left hand here up on your door. It's been shown that even just a visual reminder may help people who had forgotten things or who had just maybe said, oh, well, I have a little bit of a cough, it's probably not COVID. They may rethink things when they actually see a poster along those lines. And then active screening is one step further, which is being seen in some retail outlets where you are taking individuals' temperatures, where you're asking them to wash their hands on entry, where you're basically taking a log of who's entering. I should mention that a log is something that you should keep regardless, because that will be helpful in contact tracing. But screening as a whole is necessary. It's important to make sure that at the very baseline, you're not letting people in who have symptoms. And anyone who does have symptoms should be sent home to self-isolate and to get tested, and should also complete the self-assessment tool online if they're not sure if they should get tested. But in general, testing is now open to anyone who has any symptoms, so our recommendation is usually get tested and then self-isolate. More of the posters and resources are available at our website. Controlling the risk of transmission in your workplace speaks to reducing the chance of transmission. I've already spoke to this a bit by adjusting your workspace, so that even if the first line of defense in keeping people who are potentially sick with COVID-19 out of your space doesn't work, at least you have measures and precautions in place within your premise that actually assist with limiting risk and the chance of transmission if an exposure does happen. So you maximize physical distance and separation using things like plexiglass, using things like visual aids and markers, limiting the number of people on site, staggering shifts, ensuring that people who can work from home do work from home. Those are ways that you can help to maximize physical distance. Providing hand hygiene support such as sanitizer, or ensuring that there's soap and placed at sinks. Ensuring that people wear personal protective equipment, wearing masks and doing so properly as I've identified, and also enhancing cleaning, reducing transmission from various surfaces, objects, making sure that high-touch surfaces are cleaned more regularly. These are all steps that can be taken to limit the risk of transmission in your workplace. There are specific sector-specific resources with additional precautions and guidance that can be taken. And if you Google COVID-19 in the workplace Ontario, they should take you to the Ministry of Labour and Training and Skills Development website, where you'll be able to access the sector-specific guidance there. Finally, I'm going to talk a bit about what happens if there is a potential case or a suspected exposure of COVID-19 in your workplace. The first step is to exclude any symptomatic employees from the workplace. You should advise them to go home, get tested, self-isolate, and also, well, either get tested or complete the self-assessment tool. But like I said, it's much simpler nowadays. If someone has symptoms, send them home, tell them to get tested, and tell them then to self-isolate and await further instructions from public health. After you've sent your employees home, the second thing you should do is to actually contact public health and advise us about what you have understood, and provide us with any details that may be necessary for contact tracing. We will retain these details. We will be unable to advise you specifically if the individual has tested positive, unless and except if there is a clear exposure that's occurred at the workplace. Then we will obtain their consent to release their personal health information for the purposes of contact tracing, and then we'll work with you. But if you're already aware, you can get the ball started by identifying any details around people who may be on site, providing a visitor log, an appointment list, etc., so that we can ascertain the risk to your employees as well as the public. Step 3 is to ensure that you follow public health guidance. We will review your workplace safety plan. We will review everything else that you've sent to us. Oh, and by the way, and when you contact us, the details that you should include your workplace safety plan. But what we will do is then we will review the natures, the exposures, all the pieces that have been identified, and then depending on the results of the test and the individual, we will implement specific measures with your help to enhance the infection control that is on site. We'll double check your workplace safety plan, as well as conduct contact tracing to identify people that may need to be tested and isolated. Finally, the final step is that within 4 days of a confirmed positive case on site, and so this is if you are notified of a confirmed positive case, and if public health says that there has been a workplace exposure, then it is the employer's responsibility to notify the Ministry of Labor that an exposure has occurred. Through the 4 steps that I've talked about in terms of a case and contact management piece on workplaces, there are 3, these are the roles and responsibilities of the 3 players that are in there. As the employer, you must take all reasonable precautions to protect your employees and implement and put in place preventive measures to ensure that they're safe. This can include relying on provincial guidance. And in the event that it does come to your attention that a positive COVID-19 case has been on site and an exposure has occurred, you are required to notify the Ministry of Labor and Skills Development and Training. This is no different than your regular roles and responsibilities in respect of broader occupational health and safety. The Ministry of Labor will investigate occupational illness and notifications to determine if you're in compliance with the Occupational Health and Safety Act, and may inspect workplaces and issue orders under the Occupational Health and Safety Act. So the ministry's focus is really on occupational health and safety. Public health's focus is on controlling COVID-19 in our community. And so in the course of an exposure that may occur, we will lead the workplace investigation and investigate cases and contacts with an aim to reduce risks to other individuals and residents that are on site, residents meaning workers that may be resident in our region or in other regions, but also in making sure that there isn't a risk of exposure to the public. And in the course of our investigations, if we determine that there's significant transmission occurring, we may declare an outbreak and provide recommendations. Here are some resources that you can review in terms of everything that I've talked about today. And it's important to remember that if you head to peelregion.ca/coronavirus/business, there's lots of information there around precautions you can take, as well as links to the Ministry of Labor sector-specific guidance as well. And finally, I'm going to talk a little bit about masks, given the recent passage of the mandatory masking bylaw in the city of Brampton, as well as throughout other municipalities in the region of Peel. As I've said, masks alone do not prevent the spread of COVID-19, but they do represent an increasingly emerging evidence suggests that they do represent a way to protect other people from our germs. The ideal is that a mask needs to be worn while also practicing hand hygiene and physical distancing, and it should not be used as a measure on its own. To use an analogy, it's just like wearing a seatbelt. If you wear a seatbelt, you may reduce the overall impact of road traffic crashes in our community. But if you're also driving at 150 kilometers an hour on city streets and not maintaining a 2 kilometer or 2 car length distance, that seatbelt isn't going to do you much good. Or do any of us much good. So the same thing with masks. Masks are one part of the core 4, but they are not meant to be the only part of the core 4. There are many different types of masks, and we know that there are N95 respirators, which are protective for the wearer. These require specialized fitting and are typically used for medical professionals and first responders who are most at risk of aerosolized COVID-19. As you know, COVID-19 is typically spread through droplets, save and except for certain environmental circumstances, for example, in very poorly lit, poorly ventilated areas, and also in hospital settings where, for example, putting a tube into someone's lungs may cause smaller, finer particles of COVID-19 to be developed. The people that are in those circumstances are the ones that should be wearing N95 respirator masks. And typically these are in healthcare and hospital settings, and that's why the recommendation is not for N95 respirators for everyone, because otherwise, typically physical distancing and regular masks are enough. Same thing with the procedural and surgical masks. These are typically for medical professionals and first responders. These are typically more protective for others. They don't usually protect the wearers as much as possible. I didn't notice that when I reviewed the slides, but these are disposable and can be used. And finally, cloth masks are for everyday use. They stop the wearer from spreading germs because the respiratory droplets land on the mask rather than being exhaled or expelled, and they can be reusable. Here's how you put a mask on properly. The thing I want to remind everyone on the call is that clean hands go with wearing a mask. Clean hands go with wearing a mask. So that's the most important principle. So before you put a mask on, especially if you've been out and about, make sure you clean your hands, holding the loops, secure the mask around your ears or wherever it might be, and make sure that you're covering your mouth, nose, or chin. This also works for any other face covering that you might be using, a bandana, a scarf, whatever the case might be. Put it on, and then wash your hands again, and don't touch the front of the mask. When you are going to be taking a mask off, generally the recommendation is to wash your hands before you remove and dispose of the mask, and then wash your hands after you've removed your mask. That is the most ideal situation. In the event that it's not able to, in the event that you're not able to wash your hands before and after, at least make sure that you're washing your hands after you've touched your mask, whenever you do put it on. And take it off. There's further information about masks, which you can see at our website here, and I think this link will be available to you. So with that, I thank you very much for your attention. I think I've got about 25 minutes for questions, and so I'm happy to take questions at this time.
Thank you, Dr. Lowe. There were 2 questions that came in via email from individuals that were unable to jump on today's call. The first comes from a manufacturing company in Brampton. They actually produce face shields, and their staff are comfortable wearing the shields. They were just wondering, is there a difference between an actual face shield versus a mask? And can their employees simply wear the shield rather than an actual mask itself?
It's a great question. The masks evidence has really evolved over the last 6 months. And initially when we first learned about COVID-19, we recommended the use of masks when people had symptoms for the purposes of source control. So to be perfectly clear, when it came to masks, we have always recommended it as source control. We were like, if you are symptomatic, wear masks. In March and April, there was increasing evidence out of Europe that COVID-19 could spread asymptomatically a couple days before people even show symptoms. We have now seen this throughout our data here in Canada as well. That is one reason why this virus has spread so quickly around the world and has really stymied a lot of different countries' efforts because it can spread stealthily in that manner. And so that was where in March and April, the recommendation changed from wear when you're symptomatic to a permissive recommendation where the general public could wear a mask if they chose to. Of course, though, in March and April, the focus was less about masks and it was really about staying home and staying apart at that time to really get things under control. So in May, the general use of masks non-medical masks by the public moved to a strong recommendation because we recognized that more people were going to be out and about, and it was going to be a strong recommendation that if you couldn't maintain physical distancing, a non-medical mask would be useful. Again, still for the purposes of source control, knowing that there's people spreading before they develop symptoms. And so that is actually why at the end of June, I made the recommendation to move to a requirement to wear non-medical masks while in indoor spaces, because we were asking for clarity. We know that many in the business community, as well as many in the community as a whole, were asking for clarification about what does a strong recommendation mean when physical distancing is not a challenge or when it's difficult. So that was why we made the requirement. It was to bring clarity and consistency to a clear recommendation on wearing non-medical masks in indoor spaces and in public. The trouble is, as you can see, that is actually really quick evolving scientific evidence around a brand new disease, and it's taken us some time to get there. The challenge with face shields, particularly their use by the general public, they look kind of snazzy, they look kind of futuristic. They've only really been used by the general public probably for about the last month to a month and a half. And so the evidence is not quite there yet as to whether they are equivalent to a non-medical mask for source control in the way that we have had now 6 months worth of data on masks with COVID-19. So at this time, the bylaw does not consider face masks equivalent. The idea is that face masks are probably meant more to protect the eyes rather than the individual's nose and mouth. We know that it is the seal around that keeps respiratory droplets there. So at this time, they're not seen as equivalent. However, as the data continues to evolve, that recommendation may also change and evolve. And I think I'll also make clear as well, there's nothing to prevent someone from wearing a face mask. If they choose to wear a face mask, it may provide a protection. It's just we don't have the clear evidence that it does just yet, and it may provide source control in limiting spread. We're continuing to study face masks, given how new they are. However, if people do want to wear a face mask, they need to know that that's not covered in the bylaw, so they may also need to wear, if people want to wear face shields, they need to know that that's not necessarily considered equivalent under the bylaw, and they may also need to wear a mask depending on where in the facility they may be working. So I hope that's helpful in terms of understanding where we are with face shields and face masks.
Very helpful. We have another question from Anne. They're a dance studio and will be offering day camps starting in August. Are cohorts required to wear masks? Are staff required to wear masks? Cohort and staff will be physically distancing for the majority of the camp hours.
So if you are operating a camp and you're operating, it is closed to the public, then I believe the bylaw, and I don't know, I would defer to if there's someone from bylaw who can speak to this on the line. My understanding is that the bylaw refers to places that would ordinarily be accessed by the public in order to require the wearing of a non-medical mask in an indoor space. So first of all, if this is outdoors, then you won't need to wear masks. Second of all, if it's in an indoor space and provided that you are able to contact trace everyone who may be exposed, if there is an exposure that occurs, then I would consider that closed to the public, and then you may be able to conduct the camp while ensuring physical distancing, but not necessarily having to wear masks. But I don't know if there's someone from bylaw that wants to comment on the specifics of the bylaw on the line.
Yes, Dr. Lowe, we agree with your comments with regards to this. So the mask speaks to people that are engaged in fitness or activity in accordance to the emergency order. So in a situation like this, obviously it's always recommended, but when you engage in some sort of physical activity, the bylaw certainly doesn't speak to the requirement of wearing the face covering.
Thank you. So it sounds like as long as you are physically distanced and you are making sure that it is a closed cohort, that you're able to track everyone down in the event of an exposure, then presumably as long as you maintain the distancing, you should be able to do things without a mask, although it still remains a recommendation as my colleague just correctly identified.
Great, thank you. We have another question from Dippin. I have a small tutoring business in Brampton. My question is, I understand a mask is mandatory for anyone inside the premises. Is taking temperature for anyone entering, is that mandatory? And do we need to take their personal information for contact tracing?
Perfect, thank you for the questions, Dippin. So yes, absolutely. If you go back to what I shared in the presentation, screening is essential. So whether you choose to do active screening, which can include asking people about symptoms, taking their taking their temperature, and/or having them sanitize when they come in, those are things that you can do, and you can learn all about screening options for active screening at peelregion.ca/coronavirus/business. You can also do passive screening, which is where you put a sign up, which has maybe questions or highlights, stop and don't enter if you have COVID-19, because even that requirement is there. In general, you can do both really as well. And then in terms, it really is a strong recommendation. It's not a requirement at this time, but we strongly recommend for whatever business you might operate, that you have some way of keeping track of who is on site when. Because really when it comes down to epidemiologic analysis, when we investigate outbreaks and exposures, we're looking at three things. We're looking at people, place, and time. We're trying to figure out In the case of a case, when we have a case of COVID-19, we'll try to figure out where they might have been when they were communicable, when they were able to transmit the disease. And so if it turns out that they were in your business or your facility while they had a disease, either receiving a service or something, it would be very helpful for us to be able to see who are the individuals that were on site. If you have their contact information, then we'll be able to identify they were here on Wednesday between 8 to 5. So we need to call everyone who may have come in contact with them from 8 to 5 to figure out what was the nature of the interaction they may have had with the individual. Obviously, from a privacy perspective, you'll want to keep such a log very carefully. But in general, for most businesses, I imagine many businesses on the line, this is not new. I mean, many businesses operate on reservation lists, on appointment lists, on having visitor logs and all these other pieces. So it's just an added layer of protection in the event that there's an exposure. It will help you and help us to get to the bottom of the situation sooner and hopefully be able to identify who can return to work and which parts of the facility can be reopened sooner.
Fantastic. Another question is whether a workplace safety plan is a requirement or a best practice.
I would say I believe it's both. I have to check with I would encourage you to double check with the Ministry of Labor. But either way, whether it is a requirement or not, oh, here we go, hold on. It actually, I just looked it up for here. So it basically says that you don't need to send it to the Ministry of Labor, but presumably it's best practice. And so there's the 6 questions that you should be thinking of. And in general, as I mentioned, in the course of if there is an exposure, Peel Public Health will want to see your workplace safety plan as well. So it's highly encouraged that you have it and that you revisit it regularly.
Great, thank you. Another question, it's 2-part. So this is from Alvin. We operate a restaurant in Brampton. Is there a limit on the number of customers that are allowed inside the restaurant as they wait for their takeout orders? And then the second part of the question is, what is your recommendation when a customer refuses to wear a mask?
Thanks, Alvin, for the questions. So there's no official limit in terms of number of people, but the best practice and recommendation is that you limit it to the number of people that you can safely physically distance while they are waiting for their food. So if you've got a small restaurant facility, you might want to have 1 or 2 people tops at the time. If you've got a 100-seater facility, then maybe you could have up to a certain number of people. Again, the one thing you'll also need to remember is that the provincial guidance under stage 2 still limits public gatherings to no more than 10 individuals. So I would say 10 is probably an absolute limit, no matter how big your restaurant is. Of course, that limit increases to 50 if and when we do move to stage 3. But regardless of how many people are allowed on site, it should be, you should use the rule of thumb of, can we ensure that the people that are waiting can safely physically distance? So if that means, and I've seen some other restaurants do this, where they basically have markings on the floor, markings of places where people can wait, and then also a line outside, which also identifies where people can wait while they're distanced if they need be, if there's overflow. Then those are some of the best practices that I've seen and observed in the city. And then in respect of masks, certainly we encourage everyone who's able to wear a mask to do the right thing, to keep others safe by wearing a mask and abiding by the requirement that's been passed in the bylaw. But for individuals who have a medical exemption, they simply need to advise you that they have a medical reason for not wearing a mask, that they have an exemption, that they're claiming an exemption. And then you can, at that point, I think you could basically just manage them by ensuring that they distance or offer them alternative service, i.e. like doorside or curbside or suggesting pickup or suggesting delivery in that manner. If that's your prerogative as a business owner, or whether to let them in and ensure that they maintain safe physical distancing. So yeah, that's essentially how it works with exceptions.
Great. We have another question from Wanda. I'm an esthetician working from home. What are best practices for keeping the safety of our home when dealing with clients?
Yeah, Wanda, that's a great question. I think I would encourage you to look at the sector-specific guidance that's been released around estheticians. I think a lot of those apply regardless of whether your office is in a salon or in your home. So you'll want to do things like making sure that you're wearing PPE, a mask, face shields, your staff, if you have any staff on site, are doing the same, that your client is wearing PPE and a mask as well when they're on site. Definitely, if you're doing things with the face, making sure that the mask is left on until and except the time that they need to receive the service, making sure that you're cleaning everything regularly, disposing of things between clients, and keeping an appointment log. And ensuring that you're cleaning high-touch surfaces, places that people may have gone on a regular basis, and of course, fundamentally making sure that if people are sick, that they're not coming in and they're not seeing you, and certainly that you're not seeing people if you're sick as well. I mean, they're all the same sort of principles, but the sector-specific guidance talks a lot about that. And so I encourage you to check out what's out there for personal service settings. If you Google COVID-19 workplaces and go to the ministry's website, they should have something on barbershops, personal service settings, and tattoo parlors, I believe it's called.
Great, thank you. We have another question from Sharif. What is the best protective setup for restaurants reopening? Specifically, that customers cannot eat the food while wearing the mask or keep putting the mask on and off. What is your recommendation in this case?
So in respect of masks with restaurants, and this includes patios which are currently open, the requirement is that they wear the mask until such time that they are seated at their group and they can remove the mask for the purposes of receiving the service. So you leave your masks on while you're sitting there waiting for your food, while you're going to and from your table, while you're going to and from the bathroom. And then when that magical beer or nachos arrive, then you can take your mask off and chow down. And then once you've concluded the service, the recommendation or the requirement, at least indoors, would be that you put your masks back on, kind of thing. So, I mean, the recommendation is you wear your masks, save and except for the time that you're actually consuming the food. And then if you are indoor dining, the requirement is that the mask be on until such time that you are basically actively consuming the food. So it's similar to the idea of trying to find a place to drop someone off at Pearson Airport. As long as you're actively loading and unloading, you can be there. Otherwise, you should probably move. Same thing with a mask. It should be there if you're actively eating or drinking, but it should be on your face if you're not. And that's only indoors. Outdoors is different. Outdoors, it's recommended. But again, it's not. The bylaw only covers indoor dining, which will come in stage 3.
Great. We have another question from Anne, who owns the dance studio. When training athletes, in her case, competitive dancers, can coaches rotate? So example would be 3 hours of training with the same cohorts, but teachers change within the 3 hours. All will be physically distancing.
So as long as they're all physically distancing, washing their hands, taking those precautions, and as long as it's the same 3 teachers with the same 3 cohorts that are rotating, then that actually constitutes one big cohort that we could then conduct contact tracing on if we needed to. So the bigger challenge would be if you're rotating a bunch of teachers in and out of the same cohort. So as long as it's the same 3 teachers that are moving, so basically A, B, C kind of going between the 3 groups, that would be ideal in a single session. That would be my recommendation in that instance.
Great, thank you. We have a question from Paula. Playing of sports outdoor, what are the restrictions currently in place, if any? For example, playing soccer.
So at this time, the recommendation is that people can play team sports outdoors, but they have to maintain physical distancing. And so it becomes much more of like a passing game with soccer rather than tackling. But that's been the recommendation for now. When we move to stage 3, there will be permission for other sports and activities, and you can read all about it on the province's website, provided physical distancing is maintained, except for certain sports where that's not possible. And I think there's limitations and additional precautions that are specified in the provincial guidance. But right now, the idea is that yes, you can play certain team sports, but people have to maintain physical distancing as much as possible.
Great. We had another question that came in via email. It's in regarding to security guards that monitor customers coming in and out of the store. They have concerns that security guards are kind of standing in the way of customers that are trying to enter and exit, making it difficult for distancing, and they were wondering what the protocol or rules are for staff like outsourced security guard companies, and do those security guards need to wear masks?
So if the security guard is indoors in a retail or other environment, then they would be required to wear a non-medical mask under the bylaw unless they're claiming a medical exemption. And so that's something that I think any company providing security services should be aware of, that bylaw is in effect for indoor spaces. I think in terms of the question around passage through the front door, certainly makes sense to make sure that there is distancing as much as possible. However, we do know that transient contact is less risky than sort of prolonged close contact in transmitting coronavirus. So if you're quickly passing by a security guard, I think for the purposes of optics and the purposes of really reducing the risk, you want them to make sure that they're staying 2 meters away from people who are entering the premise. But if that's not possible, then I think it's a matter of either having the guard be mobile, as in moving away from the door when someone walks in, or just recognizing that people shouldn't linger in the space with the security guard at the front. So don't just walk in and talk on your phone kind of thing. Just walk in, walk past, and make sure that you're all wearing non-medical masks, given that it's indoors.
Thank you. Sorry, I was on mute. If a resident of Brampton feels that a business is not following the rules, the mask bylaw, should they be calling the city to, I guess, submit a complaint to bylaw? And perhaps this is a question.
I'll defer this question to our bylaw colleagues.
Mike or JP, can you?
Yes. So we encourage our resident, if they do observe individuals or business owners who are not taking reasonable steps to ensure that customers are wearing their face coverings, to contact 311. So we will assign the bylaw enforcement officer to investigate, and the likelihood of charges is against the owner the first step will be education, obviously. And if the business owner deliberately refuses to ensure and take those reasonable steps that we talked about to ensure that the customers are wearing, then there could be some charges against the business owner for not taking those reasonable steps. So for the residents, call 311. We'll assign an investigator to educate the business owner. Sometimes they may not be aware of the bylaw, and we'll make sure that they're aware. And then following this, the expectation will be for the business owners to take those steps to ensure the customers are wearing the face covering, unless they're exempt under the bylaw.
Great, thank you. I think we have time for one last question. This comes from Haytal. When purchasing a reusable mask, what criteria should individuals look for?
Yeah, it's a great question. There are lots of masks out there. There are lots of masks that purport different benefits, etc. But I'll be honest, we're talking about face coverings, and this is really about the physical barrier for your respiratory droplets. So really any mask will do, provided that it actually covers your nose and your mouth and provides a snug fit and no gapping as much as possible. That will help to conduct source control. So choose something that looks nice or fun or is practical or whatever the case might be. But that would be my recommendation: is as long as it fits your face and as long as you wear it properly, you'll be doing your part to slow the spread of COVID-19.
Wonderful, thank you, and thank you,
I'm happy
everyone.
to take another question.
Okay.
I was gonna say I'm happy to take one more question if there is one.
Okay, I don't see anything, but let's just give it a second
perfect.
to see if anyone has come up with something. If you think of something after today's session, you're happy to, email the Entrepreneur Center at BEC, that's BEC at brampton.ca, and we'll do our best to respond. If we don't know the answer, we definitely will know someone who does, and we'll make sure that
I can also say as well, peelregion.ca/coronavirus/business. There are lots of resources there that may be able to answer questions you have. And then also you can always contact our call center at 905-799-7700. They're open 8:30 a.m. till 6 p.m. 7 days a week.
Looks like we have one additional question from Sharif. Is there any contact tracing apps that you can recommend?
One's coming out. I believe Premier Ford has actually talked about it, and I imagine it will be ready to go in the coming weeks. I want to be very clear, though, that contact tracing apps are not a silver bullet. We in Peel Public Health will continue to do our contact tracing and basically bring the human element in terms of looking at the data and the overall picture. But in the absence of a contact tracing app, and even with a contact tracing app, I still encourage proprietors to keep your own records, et cetera, as an additional layer of protection. It's about protecting you and getting you and your staff and your workplace back up and running again more quickly if we're able to pull that information together and make a quicker determination. So I absolutely encourage you, appointment logs, reservation books, visitor logs, you name it, something to keep track of people who are on site so that we know who is when where. Then we'll be able to work with you. So certainly a contact tracing app will come out. I encourage everyone to download it. I plan to download it myself, but also protect yourself by keeping a log as well.
Great, thank you. And thank you everyone for joining us. There's lots of great resources available on the Region Appeals website, on the Entrepreneur Center's website at brampton.ca/back. We will follow up after today's session with an email that will include a copy of the presentation today if you're unable to download it from the attendee control panel, and we'll make sure that you get access to all the links that we shared today. So thank you, everyone. Thank you, Dr. Lowe. Thank you, Mike and JP from Bylaw. Appreciate your insight and help in responding to some questions related to Brampton Bylaw issues.
Thank you.
Thank you. Hope everyone has a wonderful day.